Chapter 17. Disease is any deviation from or interruption of the normal structure or function of any part, organ, system, or combination thereof of the body. Disease is caused by microorganisms. Disease is the absence of health. Healthcare practitioner must have an understanding of what infectious diseases are, how they are spread, and how they may be controlled. Infection is the establishment and growth of microorganisms on or in a host, resulting in injury. Infection is caused by pathogenic organisms. Pathogens have three means of causing harm. They can multiply and cause obstructions. They can cause tissue damage. They can secrete organic exotoxins which cause side effects. Categories of pathogens are bacteria, viruses, fungi, and parasitic protozoa. Bacteria are microscopic, single-celled organisms. Bacteria are prokaryotes, so they lack nuclei and membrane-bound organelles. They reside in a host as a group or cluster called a colony. Bacteria are classified as cocci, or spheres, bacilli, or rods, and spirals. Gram staining techniques are used to classify bacteria. Bacteria contain both DNA and RNA and can produce endospores. Bacteria produce a single endospore internally. Endospores are metabolically dormant and highly resistant to their external environment. Viruses are microscopic, single-cell entities that cannot live outside of a living cell because they lack the components needed for independent survival. Viruses carry their own DNA or RNA, but never both. A viral particle, the virion, attaches itself to a host cell, inserts its own genetic information, and then redirects a host cell to produce new viruses. Viruses are not affected by antibiotics. The size of a virus may vary from 20 to 250 nanometers, so direct observation of a virus is possible only through an electron microscope. Viruses may lie dormant for extended periods of time and then manifest themselves in illnesses. Fungi are eukaryotic, meaning they have a nucleus and membrane-bound organelles. Fungi are much larger than bacteria. Medically important fungi are dimorphic, meaning that they can exist in two forms, yeast and molds. Molds are branch-like. Diseases caused by fungi are of four classifications: superficial, cutaneous, subcutaneous, systemic. Parasitic protozoa are organisms are neither plant nor animal. Protozoa are larger than bacteria and are eukaryotic. As parasites, they live on or in other organisms at the expense of the host. Protozoa usually can move and are classified by their motility type as amoeboid, flagellum, cilia, or sporozoans. They can ingest food particles, and some are equipped with digestive systems. The establishment and course of an infectious disease has 6 steps. EESMDO. E. Encounter, E. Entry, S. Spread, M. Multiplication, D. Damage, O. Outcome. Encounter involves the infectious organism coming in contact with the host. Each encounter varies according to the host and microorganism. Entry is an infectious agent's access to the organism through a portal of entry. Entry may either be through engrazion or penetration. Spread is the propagation of the infectious organism. This requires overcoming the body's immune defenses. The degree of spreading is a function of the logistics of both the host and the microbe. Multiplication is the growth in the number of microbes due to mitosis. Many infectious agents must prolifically multiply before their impact is recognized by the host. There is an incubation period. Damage. Damage can be either direct or indirect. A microbe can induce a host response that also causes tissue and cell death through activation of the host's inflammatory and immune responses. Outcome can be described 3 ways. 1. The host gains control of the infectious agent and eliminates it. 2. The infectious agent overcomes host's immunity to cause disease. 3. The host and infectious agent compromise and live in a manner of symbiotic state. A simplified chain of infection is a circular process that proceeds clockwise in this sequence. Host, infectious microorganism, mode of transportation, and reservoir. Infections will not spread if any link in this chain is broken. Memorize these 4 steps. Host, infectious microorganism, mode of transportation, reservoir. Host, infectious microorganism, mode of transportation, reservoir. Host, infectious microorganism, mode of transportation, reservoir. A more elaborate chain of infection includes 1. A susceptible host. Conditions like an immune deficiency, diabetes, burns, surgery, and age influence a host's susceptibility. Host is proximate to 2. Infectious agent, which can be bacteria, viruses, parasites, or prions, a misfolded protein that induces misfolding in normal variants of the same protein leading to cellular death. Next in line is 3. A reservoir, people, water, and food. Next, 4. Portals of exit from a reservoir, blood, secretions, excretions, and skin. Number 5. Modes of transmission for these exited pathogens are physical, contact, droplet, and airborne. Lastly 6. Portals of entry into a susceptible host include mucous membranes, the respiratory system, the digestive system, and broken skin, thus completing the 6-link chain. Routes for disease transmission are air, droplet, and contact. Transmission may be exogenous or endogenous, and vector versus fomite. A mechanical vector is a living organism, such as a fly, that passively carries pathogens on its body to a new host without becoming infected itself. Healthcare. Associated infections are acquired while in the care of a medical provider. Nosocomial infections are hospital-acquired. Iatrogenic infections are acquired through the care of a practitioner. Here 6 bullet points. Compromised patients. Medical personnel. Patient flora. Contaminated healthcare environment. Interventional procedures. Blood-borne pathogens, or BBPs. Factors that encourage nosocomial infections are environment, therapeutic regimen, equipment, contamination during medical procedures, and diagnostic imaging, as well as other interventional procedures and accessories such as indwelling vascular lines, thoracostomy tubes, indwelling catheters, vascular catheters, ET tubes, and endoscopes. Patient factors that increase the potential for nosocomial infections are age, heredity, nutritional status, stress, inadequate rest or exercise, personal choice habits, health history, and inadequate defenses. Blood-borne pathogens are disease-causing microorganisms present in human blood. BBPs are considered healthcare-acquired infections, HAIs. 2 types are of primary concern in a hospital setting: HIV, human immunodeficiency virus, and HBV, hepatitis B virus. HIV virus specifically infects the immune system in a host. It infects CD4 plus T cells. It is responsible for acquired immunodeficiency syndrome, AIDS. Symptoms include weight loss, muscle and joint pain, glandular pain and swelling, and night sweats. Symptoms can remain latent for many years, and a person may be asymptomatic after exposure to HIV for as long as a decade. It may take up to 1 year for results of a blood test to become positive for HIV antibodies. The hepatitis B virus primarily affects the liver, resulting in swelling, soreness, and loss of normal liver function. Symptoms include weakness, fatigue, anorexia, nausea, abdominal pain, fever, and headache. HBV also leads to yellow skin coloration, or jaundice. Some patients are asymptomatic. Blood will test positive 2 to 6 weeks after symptoms develop. Patients can recover in 6 to 8 weeks, but blood tests will always thereafter indicate that they were exposed. Antibiotic resistance develops because, out of a large number of bacteria, a few of them are already resistant to antibiotics. Proper use of antibiotics kills both good and evil bacteria, so the naturally resistant bacteria now have plenty of room to grow. They can even transfer their resistance to other bacteria, making a bad situation even worse. Here are some defense mechanisms of the body. Internal mechanisms include mechanical barriers, chemical processes, and cellular processes. External mechanisms include normal microbial flora, physical methods such as hand washing, chemotherapeutic agents that are bactericidal and bacteriostatic agents that inhibit the growth and multiplication of bacteria without killing them, and, lastly, immunization by vaccine. Standard precautions incorporate the features of both body fluid precautions and body substance isolation. These should be used when performing procedures that may require contact with blood, body fluids, secretions, excretions, mucous membranes, and non-intact skin. One must practice biosafety in medical imaging. Transmission-based precautions include airborne precautions, droplet precautions, and contact precautions. Airborne precautions require that hands be washed both when entering and leaving the room, wearing a fit-tested N95 or higher level respirator which should be removed after exiting the room and closing the door, and ensuring that the door to the room remain closed. Droplet precautions require that hands be washed both when entering and leaving the room, ensuring that one's eyes, nose, and mouth are covered before entering, and removing this protection before exiting the room. Contact precautions require that hands be washed both when entering and leaving the room, gloves and a gown be put on before entering and discarded before leaving. These gloves and gown must not be reused for any other patient. Equipment used must be dedicated or disposable. Reusable equipment must be cleaned and disinfected before it is used for another person. Asepsis is classified as either surgical asepsis, which eliminates all pathogens, or medical asepsis, which minimizes pathogens. Proper hand washing is very important to medical asepsis, which is also referred to as clean technique, to reduce the number of pathogens. This is prerequisite for the administration of medications, enemas, tube feedings, and for proper daily hygiene. Chemical methods of asepsis utilize disinfectants that are either bacteriostatic or bactericidal. These can be very harsh. Bleach kills bacteria by damaging their cells. 70% plus alcohol denatures cell proteins, leading to cell death. Iodine penetrates the cell wall of microorganisms, causing disruption of their metabolism. Chemical antisepsis must not harm people. This is used for the treatment of operational fields, a surgeon's hands, for the sterilization of gloves and surgical instruments, stitching material, and for the disinfection of rooms. Physical methods of asepsis include sterilization by autoclave. An aseptic field is needed for dressing changes, catheterizations, and surgical procedures. Again, sterilization is the absolute killing of all life forms. Heat is the most effective method, especially moist heat with pressure as produced by an autoclave. Ultraviolet, or UV light, is also effective. Sterile supplies must be sealed, labeled, and have an expiration date. To repeat, chemical methods of asepsis are disinfectants that are bacteriostatic or bactericidal. Physical methods of asepsis like the autoclave enable sterilization. Standard precautions include precautions with body fluids and body substance isolation. These should be used when handling blood, body tissues, body fluids, secretions, excretions, etc., and also includes the handling and disposal of soiled or contaminated materials. Components are hand washing, gloving, personal protective equipment, or PPE, needle recapping, and the proper containment of biospills. Because a radiologic technologist comes in contact with a myriad of patients on a daily basis, hand washing must absolutely be performed before and after each patient is handled. This practice provides the simplest method of environmental control of microbes. Make hand washing a working lifestyle and second nature in your personal life. Transmission-based precautions are employed whenever a patient is infected with a pathologic organism or communicable disease. These are particularly important for patients who are immunocompromised. They are used along with standard precautions and include the aforementioned airborne precautions, droplet precautions, and contact precautions. When using protected imaging plates, remove the protective bag, never touching the inside, while an assistant removes the cassette without touching the outside of the bag.